Hello, everybody. My name is Golnaz Nouri. I'm the medical director at Southern Indiana Rehab Hospital in New Albany, Indiana, and a board certified physical medicine and rehabilitation physician. Today, I wanted to talk to you about our brain injury program. A brain injury happens when someone has had some major trauma to their brain, which is classified as traumatic brain injury, or a non-traumatic brain injury or acquired brain injury, which is if somebody has had some kind of a infection in their brain, tumor, or lack of oxygen to their brain. When patient has had a brain injury, there are medical complications that come with it that can include bowel or bladder issues, seizures, pressure ulcers, swallowing issues, maybe sometimes requiring to have a tube in their stomach, sometimes with breathing issues with a tracheostomy in their trachea, in their neck. And they could also have cognitive issues and psychological issues. So at Southern Indiana Rehab Hospital, we come up with an individualized therapy program and plan for each of our patients with the help of our interdisciplinary team, which includes 24/7 nursing, a board certified physical medicine rehabilitation physician, including me, a physical therapist, occupational therapist, a speech language pathologist, case management, psychologist, and we also have an in-house pharmacist, dietitian, and respiratory therapist. So usually there are two stages for a patient who's had some kind of a brain injury that needs to come to a rehab facility. The first stage would be acute inpatient rehab, where a patient gets very intense therapy that is an average of 3 hours of therapy per day, split up into sessions, and receiving the services that I already described to you. We also have meetings with our team, including our psychologist and therapists, and discuss each of our patients, each of our brain injury patients in those meetings, and also have family meetings to educate the families regarding brain injury patients, their progress, their prognosis, and what to expect, and how to take care of the patients when they go home. So once the patient is stable and at a level functionally that they could be discharged, we recommend them to go to our outpatient therapy program, which is a continuum of care after our acute inpatient rehabilitation stay. In the outpatient program, it's less intense therapy, but again, the disciplines of therapy work together for the goal of reintegrating the patient back into the community. And that is always the goal of rehab, being acute inpatient rehab, outpatient therapy, and that is going back to school, back to work, getting back to their leisure activities, hanging out with their grandkids, whatever they love to do in the past. And then I also wanted to mention that we are accredited by the Commission on Accreditation of Rehab Facilities and hold a specialty certification from the Commission to certify that we're committed to providing the highest quality of care to our patients. So we are CARF accredited for brain injury, stroke, and general rehabilitation. Thank you for listening to me.